The advanced practice nurses has really been a lot of the focus, and also increasing enrollments. So I say those would be the two bills that I would think that nurses would be interested in. If we can get more nurses enrolled in schools, that means that more nurses are going to come into the workforce, which means a better work environment for them.
We're really proud that our acute care residency collaborative has about an 11.5% attrition rate. So much lower. We really need to support those new nurses. We want them to stay in their roles, and we want them to do well.
Hey everyone, welcome to the Nursing Insights podcast. My name is Stephanie, and I'm a registered nurse practicing in the state of New Jersey. Getting right to it, the state of healthcare right now is tough, to say the least. Let's just say that the nursing shortage does not spark joy. We can sit in that and stew in it for a while, but we can't live in it forever. Things are changing. So join me as your host as I partner with the New Jersey Collaborating Center for Nursing to hear from nurses across the state about their experiences, trials, and triumphs in the nursing profession. Today on the Nursing Insights podcast, we have Dr. Edna Cadmus, the Executive Director of the New Jersey Collaborating Center for Nursing, and Dr. Daria Waszak, the Assistant Director of the NJCCN. Dr. Cadmus and Dr. Waszak, thank you so much for joining us on the podcast today.
Thank you for having us.
We're so excited to talk today about the release of the most recent report, our New Jersey Nursing Data and Analysis Report for 2025, that was released just last month and has some amazing data around our educational capacity, our workforce supply data and demand data for the state. So on a national level, we're expecting that there's going to be a continued shortage for nursing. And I'd love to understand a little bit about what that data looks on a national scale and then what that looks like for us here within the state of New Jersey. Could you tell us a little bit about that landscape data across the U.S. and the different cadres of nurses that we'll see?
Yeah, so we know that we have more people who are living longer with more healthcare conditions, chronic healthcare conditions, and that care is complex and changing. So HRSA, the Health Resources and Services Administration, has taken a look and done some workforce projections considering all of those types of factors and has determined what the projected shortage would be over 5-year increments. And the shortage for RNs is pretty consistent over the coming 5-year increments, 10%, 10%, and by 2036, 9% shortage. Whereas licensed practical nurses, it's slightly going up, 7% in 2026, 9% in 2031, and up to 12% in 2036. Whereas advanced practice nurses, it's a little bit at a decline with a slight increase in 2036.
I see. Dr. Cadmus, would you be able to give us a little bit of context of, on a national scale, we're seeing these trends are rather stable. Within New Jersey, what does the data look like specifically in our corner of the country?
Sure. So we look at both supply and demand, and in supply, we're looking at educational capacity first. And what we're seeing currently is that the pre-licensure RN enrollment is down and that graduation rates are flat. And so with those two factors alone, that's of concern, obviously, because we need to really increase our pipeline of nurses into the profession. We also know that we have a faculty shortage. In this data, we've seen that we have 70 FTEs vacant in the state of New Jersey, full-time equivalents for faculty in the RN programs, and 30 FTEs vacant in the LPN programs. So not having enough faculty and not then being able to enroll more RNs is of concern for the state. We also know that nurses are retiring and they will continue to retire. The baby boomers are still in that phase, right? So we know that 6% of the RNs intend to retire within the next 2 years, 3% intend to retire in the next 2 years for LPNs, and 4% for advanced practice nurses. So those factors play into all of this as we're looking at supply. When we look at demand, we know that there's an anticipated growth in both LPN, RN, and NPN, advanced practice nurse roles, between 2023 and 2033. So we have to address the pipeline in order to meet the demand. We also know turnover rates continue to be a little lower than last year, but still on a high side. LPN turnover is 44%, RN turnover is 25%, and nurse practitioner turnover is 21%. So we've got to stabilize our workforce, and that's some of the work that the center has been working on.
And Dr. Cadmus, would you be able to also give us a scale of where we fall compared to other states?
So I think really Daria's report shows that we are one of 10 states, based on the HRSA report, that are going to have a major shortage. So just kind of putting it into that context.
Thank you. And Dr. Waszak, is there anything that you think is important to flavor that additional context in terms of where New Jersey falls?
No, I think Edna described it best. They did list us in one of their top states for the projections going to 2036. So New Jersey does need to pay attention.
Absolutely. And so what types of initiatives or programs are we starting to look at in order to help address some of these supply and demand issues?
Well, here at the center, we have a growing acute care RN residency program started in 2020. And since 2020, more than 4,500 full-time and part-time RN residents have gone through the residency collaborative through the state. We have 22 hospitals participating, and 14 participate through a grant through the New Jersey Department of Labor Workforce Development Growing Apprenticeships in Non-Traditional Sectors program, otherwise known as GAINS. It's a lot easier to say. And just looking at those residents that participated through this grant, we have 2,839 since 2020 and 800 just in the last 12 months. So it's a very well-populated program, and we know it works very well. We partner with Vizient, a national healthcare performance improvement company. And through this partnership, we can offer support and a structured environment for our new hires. We know that there's a bridge going from the classroom setting and from clinicals to an actual job. We know that the attrition is high for new nurses. The NSI, one of the companies we get our numbers from, looking at the national landscape for attrition, they say more than 23% is the attrition for new nurses or first-year nurses in their jobs. So we're really proud that our acute care residency collaborative has about an 11.5% attrition rate. So much lower. We really need to support those new nurses. We want them to stay in their roles, and we want them to do well. One of the things that we also look at is nurse competence, and nurses rate their own competency over time. And they start out rating their competency at about 4 when they start the program, and it grows to more than 6 by the end of the 12 months. So we're really proud to see that as well.
And my understanding is we also have these transition into practice programs, the residencies in different specialty areas as well. Is that correct?
That's right. And we're working right now on a long-term care nurse residency. It's fully online for both RNs and LPNs who are new to practice in that setting. We have currently 6 organizations that are participating with us. We would love to have more organizations engaged to help in terms of retaining both RNs and LPNs in that setting. We know that they have a very high turnover and a high need. So the residency was one solution to address some of their concerns about turnover. The other program that we have is the Advanced Practice Provider Transition into Practice program, which we launched in 2024. Currently, we have 3 organizations that are participating in that program with about 25 advanced practice nurses. And the program is designed to have both a Vizient component and a Thrive component. So they have partnered to help in terms of providing this 12-month transition into practice program for advanced practice nurses. And it's in all different specialties. So we are anxious to see how this continues to grow, because we feel that all nurses deserve to have some type of transition into practice program.
Yes, that's amazing. And so I was curious a little bit. You're saying this just kicked off last year. Is there anything you could share about what type of curriculum or what type of engagement the nurses are having in the program?
So for the advanced practice nurses, they go into different specialties. So it could be family medicine, it could be emergency medicine, cardiology, psych, mental health, critical care, and there's more that they continue to develop. So they go into cohorts based on their specialty when they graduate. And just from the feedback that we've received so far, the advanced practice nurses definitely see this as a positive in helping them to transition into practice. They have had nothing but positive feedback on the curriculum because it looks at things like what medications are you using? What testing should you do? Which outcomes should you be looking for? And some of the newer treatments or types of care that they might not have experienced while they were in school. So it's been so far very positive.
That's amazing. And so I think this is also a perfect time to plug that our next episode is going to be getting into a deeper dive of our advanced practice providers and their transition to practice programs. So hope you stay tuned for the next program, which we know is going to be rich and full of information about those transition programs. We also know, Edna, Dr. Cadmus, that we have some legislative bills pending, and that's something that we review in the report as well. Would you mind sharing with us a little bit about those bills?
Sure. So we have a faculty loan redemption program that actually should be kicking off in the spring so that faculty who have loans can get up to $50,000 over 5 years if they're full-time in an academic setting. So we're glad to see that that has been moving along. There's also a primary care practitioner loan redemption program, and that includes funding for advanced practice nurses. There are some modifications that are going on with the bill, but it is currently available to advanced practice nurses, and they should definitely take advantage of that loan redemption. Eliminating the joint protocol for advanced practice nurses continues to be one of the areas that we advocate for so that we can improve access. And then there is a large bill, which hopefully will be broken up into several bills that we're focused on right now, which would help in terms of expanding enrollment in schools of nursing by providing grants to those schools where they can demonstrate that they're going to increase enrollment. And that was for $25 million. Moving the CNAs to the New Jersey Board of Nursing so we can also look at that workforce. Preceptor tax credits for advanced practice nurse student preceptors, and that was up to $10 million. And making some changes in terms of how data is collected so that it would become mandatory for all licensed nurses as well as for other healthcare workers. So those are just some of the things that we're working on right now in terms of bills.
And as we hope to see those bills pass, is there any way you could translate to what those would mean for the average nurse working in a healthcare system? Anything that we would be on the lookout for?
The advanced practice nurses has really been a lot of the focus and also increasing enrollments. So I say those would be the two bills that I would think that nurses would be interested in. If we can get more nurses enrolled in schools, that means that more nurses are going to come into the workforce, which means a better work environment for them.
That's amazing. And I know in terms of better work environment, there was also work being done with the New Jersey Nursing Emotional Wellbeing Institute. Could you tell us about that?
Sure. So New Jersey New is focused primarily on providing stress first aid training to nurses, as well as doing virtual Schwartz rounds. And those virtual Schwartz rounds are really there to have different cases of concern that nurses may have around their work environment, and then to look at solutions, right? How can you also help in terms of providing some new strategies so that nurses can have a better perception of their work environment?
The center and NJNU are partnering together to do a study on our RN residents to take a look at stress. And so we can kind of analyze what the experience is for residents with regard to stress and how it may relate to their confidence and competence and their retention.
I always like to look at what's the positive things that have come out from the data. And this year, we actually looked at perceived job satisfaction of LPNs, RNs, and APNs. And consistently, nurses identified that they were either extremely satisfied or very satisfied in a higher percentage than previous years. And that's pretty consistent with the national data that just came out from ANA. So we're happy to see that their job satisfaction, their perceived job satisfaction is better. We measured that in the last licensure renewal. And also, we've seen that salaries have increased for nurses across the board, both LPNs, RNs, and advanced practice nurses. And those are things that we feel are very important to highlight because we've seen that turn.
Increased compensation and increased well-being are both things of satisfaction. I mean, those are wins. Those are huge wins across the board. Has there been any feedback or even any sort of conjecture about where some of those changes came from, some of those trajectories upward?
I don't think we know from the data, but if I had to guess, I would say that most likely now that we're starting to level off a little bit in some of these organizations by hiring new people, by putting in programs, by not having to focus on COVID as their primary focus, I think we're seeing changes in work environment that are being implemented, across the state. And so I think those are all positive things, right? We know that some of the staffing ratios have improved. So all of those kinds of things contribute, right, to your job satisfaction.
You also mentioned that the New Jersey News virtual Schwartz rounds have been very popular among nurses. It's an opportunity for nurses to discuss in a safe place some of the topics that they're involved with, whether it's issues common for night nurses or for a particular type of nurse. They have a variety of different focuses. So anyone interested in learning more about the virtual Schwartz round can go to njnew.org, or they can go to NJCCN.org and get to NJnew from there. And they recently hosted their 100th session. They've engaged more than 6,000 nurses across the state, which is fantastic.
What a way to both engage in your profession and also build community. I mean, that's an avenue in which you can really engage your profession in a way that others are not going to see the same way. It's just a beautiful opportunity to do. Was there anything you wanted to share about the Certified Nursing Assisted Survey? I saw that that's a first report release. That sounds like it's exciting because you had shared Dr. Cadmus that's now underneath the New Jersey Board of Nursing.
Well, no, they haven't moved to the Board of Nursing yet. But the CNA survey was actually supported by the Department of Human Services and Office of Aging to help fund us to be able to do that study, along with our colleagues from the Essential Jobs, Essential Care Coalition. And it's the first report where we actually have been able to get some basic information from certified nursing assistants in terms of their demographics, but also in terms of some of their concerns. And so we've tried to give them voice through this report.
It seems that there's quite a lot of information that they have to share. When we're talking about turnover, it looks like their numbers are quite high, and it's something that will directly affect the workforce.
And there's a lot of bills that are focused around the certified nursing assistant that are going on right now.
And almost half of CNA respondents for the survey express interest in advancing to, for example, an RN role or an LPN role. So that is great to showcase. We have some spotlights that we're trying to promote on our social media just to show all the different pathways within nursing that we encourage and hope to inspire nurses to elevate their practice by going for a new license or going into a new specialty.
Absolutely.
Anyone who would like to learn more about our data and our reports, we have a lot of information on NJCCN.org. You can access not only these podcasts, but you can access our most recent reports. Our new report from 2025 is there, and we have an interactive dashboard that's really user-friendly. It's great for students, leaders alike, to look for whatever data you're interested in finding. There are also some infographics there, and as well, of course, access to the full report and results.
Thank you so much for sharing, Dr. Waszak. And also, if folks are interested in learning more about the Transition to Practice programs, is that also available on the website?
Yes, all of those programs are listed there, and they can see what organizations are participating, because we encourage students always to think about going to an organization that helps support them during that first year of practice.
Wonderful. Thank you so much, both of you, for joining us on the podcast today, for sharing your insights from this deep and wonderfully interesting data. We appreciate your time, and thank you for joining us, listeners, on the Nursing Insights podcast.